I think I'm live. I think there is some delays I can see. Significant delay. Let me try go to the settings. Think we are live. Okay, let's see. Let's see if people come. I think this is the first time it's going to be some technical difficulties, definitely. I think there's significant delay. We'll see how we can manage that. It's good to let at least 10 minutes to pass, so at least the YouTube algorithm won't ban us, because as I heard, it analyzes only the first 10 minutes, and if you mention anything about the sea or any treatment, then the video get removed. Okay, I see some people are on Facebook, but I'm not sure how can I read the comments. Unfortunately, I couldn't do live on Instagram, as I think I'm restricted on Instagram, so I can't go live. And this is a new YouTube channel. We will see if we can keep up. Facebook also is first time, but looks like it's working. I see that some people are watching, but I cannot see the comments. So if you're on Facebook, try to go to YouTube. So there you can, maybe you're sending me, you're putting comments, I cannot see it, so please go to YouTube so I can see your comments or questions if you have any. I put in Facebook just for the test if, they're gonna shut down the video or not. I will try to put the YouTube link on Facebook. Hello, yes, I can see. Very happy one. I left Facebook to come to YouTube. Welcome. Yeah, thank you. I can easily see the comments on YouTube, but on Facebook, you had only hello messages on Facebook. Okay, great. All right, great. Let me know, is it the stream is good, the sound is good, it's not lagging, there's no issues? Let me know in the comments, please, or in the chat. Very good. All right. Okay. Thank you. Okay. Okay. I see. The link on Instagram just got uploaded. Hello. Good afternoon. Hello. Adrina. Hello. If you have any questions, or I think let's have 10 minutes pass. Then we can start talking about, the topic. Because I'm sure if we're gonna start talking now, then the video is gonna get removed. So let's let 10 minutes. Let me know where, say hi, and then let me know where I'm from. Just general chatting before we start into the spicy topics. All right, I just posted to Instagram, so we will see if people will join. How is the weather? The weather is good. I think it's autumn. Not very cold, not very hot. I think it's good in Europe. From Canada. The arena from Canada. Hello. On your exclusive platform. Yeah, I know you. Yeah, I remember you. I think we will see if I can make something similar to the exclusive platform because it's more interactive. So maybe I will do put a Zoom link, and then so people maybe if they want to join the call and ask question live, maybe they can click a link somewhere and join. I saw some people doing it, so I will see. But I like that's better because I think the platform was 10 people, so you can fit in Zoom. But here, yeah, I'm not sure how you can do it, but yeah, I think I like the interactive one in the exclusive platform better. But I'm just trying here. We will see. Do you like movies? Yes, but I don't like new movies. I like old movies. Maybe I think the last maybe from early 2000s. These are the last videos, the last movies I would watch. I think new movies are not the best in my opinion. Not like the older one. I still until today I watch older movies. So especially as you said around 2000, early 2000, I think a lot of American movies, Indian movies, Arab movies, all kind of movies. Me neither. Yeah, 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 it's I don't want to get in that, but yeah, the whole thing is messed up. So songs are not the same, movies are not the same. Yeah, everything is soulless these days. So yeah, so I watch everything. As I said, late 90s, early 2000. I think that's the peak for creativity, art, movies. I still watch maybe some movies today here and there, but because of old actors maybe, or an old title that maybe remade and then they kept the same, maybe, values. Then I would watch that, but no, in general, not a huge fan. 80s music is the best. Yeah, yeah. I think it's yeah. I like some. I like as I said, like maybe because I was maybe that was my teenage years in 90s, late 90s, early 2000. I was wondering about how different would be doing if one is in remission. Do we continue the protocol for another 6 months after remission? Yes, that's what I would do. I would. Okay, so I think 10 minutes passed. Yeah, for 50 minutes. I think maybe we should start talking, Yeah, so my philosophy is even if you are confirmed full remission, I will just continue the protocol as it is. So some part of the protocols you need to continue forever, especially people. Let's say before the protocol you had stubborn high blood glucose, you are pre-diabetic, insulin resistant, then you should follow keto for life. So you should always, or maybe you can switch to a low carb diet. But and most of the natural supplements that's gonna stay, like the vitamin D, the magnesium, the omega-3, curcumin, these are can stay because these are good for the health in general. But I think the only part maybe you're asking and people ask is the repurposed medication. So how long can I take these? And for me, it's like, yes, 3 to 6 months after remission. Yes, I would keep, I will keep the same intensity for 3 months, and then after 3 months, I will try to lower the dose until maybe at 6 months. I will use it less frequent. That's how I do it. And there's a good thing now you can monitor after remission is circulating tumor cells. That's a good marker. So you can actually have clean scans, and then you do circulating tumor cells, and then they still a bit elevated, or that means you're not really inflammation. So you still want to continue, and then once you get these to zero, I think that's when the time to ease on the repurposed medication. But the healthy lifestyle, the exercise, I think that's it's forever. 50s music. Okay, I'm too young for that. I think the comments are very pop-up chat. Okay, let me try to make it big. Okay, amazing. Hi doctor, thanks for this live. Can I use ivermectin for prevention? Yes. I think you should follow the core first. So you eat clean, no processed food, no junk food. You exercise, you take vitamin D, magnesium, and omega-3. And yes, you do the basic first. Once you do the basic, that's like you want to take it to the next level. You want to be more fancy. Maybe you are suspicious of parasites. So yeah, then you can take ivermectin. Ivermectin is completely safe. I just I order some pills just for testing. I'm taking it just for fun. So they have almost zero side effects. Or if you want to take 12 milligrams, for example, per day, it just starts drinking water. So it's not a big deal. So yes, you can use it, but it's not essential. I'll stick with the essential first. Once you fulfill the essential things, then you can use ivermectin, no problem. Is there any solid research trial beginning with the repurpose for drugs? There is none, and it won't. I don't think it will happen. So that's the thing. If they will, I think there are some preclinical trials and everything. And then they use it combining with chemo because, of course, they want to always prioritize chemo, radiation, conventional treatments, and they want to add repurposed medication. And they say, okay, yeah, it helps. It helps, with the results, whatever. But the repurposed medication alone, or like any alternative protocol, it's not gonna happen. It's not gonna happen. So there's no money in it. There's no money like in like $1 pill of ivermectin, or like $20 pill on a bottle of vitamin D, So in order to have a large scale clinical trial, you need to make, you need to project like making millions or billions with, a chemo or any other treatments. So yeah, I don't think it will ever happen. But for me, it's like some people they want to have clinical trial, but for me it's like case reports is more than enough. We just need more case reports, documented case reports. That's what we need. So like a case study, you did this study and there's 3 cases before and after, the scans, the blood tests, and then it's written in a professional documented way. I think that's more enough for me. So we are lacking, we are lacking case reports, definitely for that. I will be myself posting case reports. So that's what I would focus on. But clinical trials, no. I don't think it will happen. I have metastases in the lungs, liver, and bones from breast cancer, but my CA15-3 marker is always low, between 9 and 16. Is that normal? Yeah, I mean, if the CA15-3 marker is low, that means maybe the cancer in the breast is not active anymore and they migrated so to the lungs, liver, and bones. So you should be looking for CA99, maybe for the liver. For the bones, alkaline phosphatase. See these numbers. You have to monitor these numbers. And for the lungs, there's called CIFRA. These are the tumor markers for these. But if the 15-3 is low, that means the original breast cancer is not active anymore, or maybe slightly active. So that's what it is. I had breast cancer, and now only I had a breast cancer. Is it the same person? Yeah. Okay. Yeah, I think I answered you. Have you dealt with low grade C? Okay. I need to increase the. Have you dealt with low grade serous neoplasm stage 4? And if so, what was the treatment plan? Not particularly, but for me is like cancer is cancer. I think yes, what matters is the organ, because of course, I mean, maybe different organ, slightly different approaches, but cancer is cancer. It's just still metabolic dysfunction, metabolic disease, and the protocol will work on almost all type of cancers. And then of course, if you get a personalized protocol, that's where you, as I said, the organ matters. So the prostate, the liver, the lungs, these can have maybe additional few supplements, but all this classification, you understand, it's for a reason to justify different treatments. So usually I just ignore all of these classifications and just stick with this is the cancer, this is the origin organ, and then this is the metastasis locations, the sizes, and that's what I care about. But all these classifications, and then this is just to justify different treatments, different chemos, different genetic mutations, and I don't follow that one. So to answer your questions, I think the same protocol will work. Hello, doctor. What are your thoughts on DCA therapy? I think it's very good. It's on my list. I still didn't get to it. And for me, it's like it has some documented side effects, which is I don't remember the side effects, but you have to be careful and you have to combine it, I think, with B complex or B1, as I remember. But yes, it's my list, and they have to test it first. Maybe some patients who's, is going to be brave a bit to test it, and you have to do it carefully with a low dose, increase the dose, see the symptoms, and then maybe I will start talking about it. But for now, I don't have any case reports, and then I don't have any practical evidence, because again, so the things with the protocol is ivermectin, fenbendazole, everything I list in the protocol, I have experience with it, and I know how to manage it and control it. That's the most important thing, because there's hundreds of things that works for cancer. There's a lot of repurposed medications, but can you manage it? Do you know the side effects? Do you know how to deal with the side effects? When things goes wrong, do you know which one to pause or lower the dose or take it off? If you stack, I see some protocols, they stack in 5, 6, 7, 8 different, repurposed medications or different supplements, a long list of supplements. But when things goes wrong, so which one you're going to blame, or which one you're going to select to eliminate or lower? You won't know. So this is why I try to, stick with the very essentials. Every supplement on the protocol and every repurposed medication has a purpose there. And this is what's going to the information is going to be in my upcoming paper, Targeted Metabolic Therapy. So you target the cancer from different pathways, and then you also fix your metabolism with different ways. And for each supplements, there's a role there. So there's no overlapping. There's not, I mean, the same supplement do the same thing. So each supplement do a different thing. And then, of course, if you, as I said, know them and you master them, you know how to manage them. And most of them also, they don't have severe side effects. So these are why in the protocol, it's carefully selected, usually safe. And then if things, goes wrong, I know how to manage it. So this is DCA, one of the things, as I said, I don't know how to manage it. I don't have experience, but I know it's good. I read it's good. There's some papers which is good. Like other repurposed medication too. But yes, I need experience with it. And if I see it, very useful, I will introduce it. My doctor never did a marker test. He said because I have lymphedema in my arm, said would not be accurate results. What do you think? This doctor is stupid. I mean, most of the doctors are stupid and you should ignore them. So you should go and do the blood test, do the tumor markers, do the liver markers, do the kidney markers, your blood glucose levels, inflammation markers, regardless if he accepts or not. If he say, no, I want order, go do it in private lab. I don't listen. Most of the cases you have to ignore the doctors. I mean, don't tell him in his face, of course, but no, just do it for yourself and, keep it for yourself and try to learn how to read the blood test and monitor yourself by yourself. The doctors won't do it. The doctor will overlook everything except, I would say, maybe the blood counts and, the only one thing they want to know is, can you take more chemo? Can you take more radiation? And that's what they will look for. So ignore your doctor. What kind of blood test to get for circulating tumor cells? Metastatic sarcoma cells, carcinoma. What is the best called? It's called circulating tumor cells. So this is the test. I think it's called signature. Circulating tumor cells. I think it's not available in all the labs. I think it only in few labs. But yes, ask for circulating tumor cells and then. But I'm telling you, this is after remission. If you have an active cancer, that means you have to rely on tumor markers and scans. But after remission, you can use the circulating tumor cells to monitor your remission. Do you consult for healthy weight loss and fatigue? Yeah, I think that's easy to fix. So yeah, feel free to book a consultation. DCA therapy. What are your thoughts? I already talked about DCA. I think it's good, but I don't have experience with it. And it's not, I think it's not, I want to say safe. Because guys, you have to understand. So we are talking here self-administrated protocols. I'm not talking about clinical, because it will be a whole story if if there is a clinic who apply my protocol and then you have the IVs, the high quality supplements, you have the diet. That's a totally different story. But self-administrated protocols like mine, like most of you guys are self-administrating these. So I'll be careful with using DCA as I read. So it can have some side effects, and the side effects are not like ivermectin or fenbendazole, mebendazole, where blurred vision, fatigue. It's easy and manageable. Elevated liver enzymes sometimes, which is easy manageable too, but DCA have a different side effects. I think it's neurological side effects, as I remember. So if you have an experienced doctor who deal with it and he can monitor you, yes, then this would be good. But if you want to self-administrate it, I don't think it's a good idea. How many days weekly to be on a therapy and how many days off? What kind of therapy? Are the case reports in your Instagram? Not all of them. Some of them from studies and some of them are mine. So it's a mixed. So yeah, try to look for case reports as much as possible. So half of them are mine and half of them are from actual studies, other doctors. Case reports for breast cancer. Which type of blood test to check markers do you need to make? For breast cancer, which types of blood tests to check markers do you need to take? So if you're talking about breast tumor markers, CA15-3 and CA2729. So these are the two for the breast cancer, and also CEA2, which is more general but sometimes elevated with breast cancer too. These are the 3 tumor markers for breast cancer. When we expect the research from you? I'm still working on the paper. It's it's a bit it's a long. I have to make a lot of corrections. So basically, because I have experience with the reviewers, they would be very harsh. They would criticize everything. So I'm trying to be harsh on myself. So I'm overcorrecting the paper. So I make versions and I correct a lot and then do it again. So I wanna have a more polished version before submission, but I didn't submit yet. So even after submission, it would take months to be approved. So it's a long work. I was diagnosed with ERP plus. HER2 was cancer-free in 2017. I have been since. I think I don't go for scans. My CA are all within range. However, my ferritin is 236. I think the ferritin is slightly high. Maybe because of, it could be inflammation, because ferritin is, if it's high and you have cancer or history of cancer, it's most likely that maybe there is inflammation. So I would test for CRP, ESR, see if the numbers are high or not. And I will check circulating tumor cells too. So this is how I would do it. I didn't check. Is the live is going good, guys? Can you let me know in the chat if the audio is good? Can you hear me? I hope I was not talking to myself this whole time. Oh my god. Can you let me know in the chat, please, if can you hear me clearly? Audio could be a bit higher. Okay. Let me see what I can do. Okay. I think that's the maximum volume. Okay, coming back to the cancers. If liver enzymes are elevated, what do we reduce fenbendazole dose or ivermectin? Actually, this is the topic of the video which I was supposed to film and post today, but I will post it tomorrow because I'm doing this live. Yes, so you should watch the video tomorrow, but I'll give you a few hints. So first, when you see liver, so the rule is to monitor your liver function each 4 weeks. That's a must. When you are in a protocol or any other protocols, even conventional treatment, chemo, radiation, whatever, you need to always do blood tests each 4 weeks to monitor the kidneys, the blood counts, the liver, everything. So if you saw a liver enzymes elevated, you should immediately stop the repurposed medication, and also most of the natural supplements like berberine, for example, even vitamin D. You should take a break from it, and you should immediately take melprednisol and tutka, which they are already in the protocol, but you should double the dose. So 500 milligrams of melprednisol and tutka 2 times a day. You take dandelion root tea, and then NAC 600 milligrams 2 times. And then if you are in keto, you should switch a bit to moderate fat, moderate protein, moderate carb with some steamed vegetables, and then you drink plenty of water, and then you test the liver enzymes each 10 days. And usually they come back within 3 to 4 weeks to normal, even earlier sometimes. Sometimes it's just slight elevation and they come back after 1 week. Sometimes it takes 3 to 4 weeks. But it's not liver toxicity. It's not liver damage. It just the liver was overwhelmed. Maybe the quality maybe of medication is not that good. Maybe the dose is very high, or maybe just the liver is weak. You are weak in general. So, but this happens often, and should not panic. You just do what I told you. You take a break from the repurposed medication, most of the supplements, too. Magnesium, you can keep magnesium. You should take it, as I said. Mactosol, Tutka, Dandelion, root tea. If you have liver pain, you can use castor oil packs on the liver. That can help too. So this is what you should do, and then I'll talk about it tomorrow in details in the video. But the most important thing I want you to take from this live, you should monitor your markers each 4 weeks. That's a must. Well, as I said, whatever you do in the protocol, whatever you do in chemo, radiation, you should always monitor blood counts, liver, kidney markers, inflammation markers, blood glucose markers, and of course the tumor markers. So the tumor markers, don't obsess with it. It can, go up in 1 month, but 1 or 2 elevations, you should not panic. So, but maybe each 3 months, you should monitor. I mean, you should monitor it. So each 4 weeks, but don't make a judgment based on small elevation. But the other, other markers like the blood counts, as I said, hemoglobin, look for anemia, platelets, lymphocytes for immune system, liver and kidney enzymes. These are the must. So you need to monitor. What are your thoughts on spike protein and how important it is to reduce them to heal from cancer? This is a very important question, actually. I have a patient which is following up with me, and she has metastatic, I think, breast cancer. And we are following the protocol. We are, making progress. And she decided to do spike protein test. I didn't ask for it, but she decided to do it. And we found the spike protein is very elevated, 2,500. Very, very, very high. And she took the COVID vaccine back in 2021. She said she was forced. But for me, it's like, I think this was a blind spot for me too. Maybe I will start to test for spike proteins very often. And of course, I immediately, we have to add nattokinase, bromelain, and curcumin as a spike protein detox. And also, if you are in the protocol already, there's a lot of spike protein breakdown agents on the protocol if you follow the whole protocol. But yes, I think if you have high spike protein levels, they can contribute to cancer and also keeping the cancer active, or firing up the cancer. So yeah, there's a huge correlation between spike protein and cancer. And you should, as I said, encourage everyone, if you took the COVID vaccine, to do spike protein test. And then if it's high, you should immediately follow the spike protein detox by Dr. McCullough. Or if you have cancer, you should follow the protocol and monitor the spike protein, and you want it to go down. Right, should I look for tumor markers for metastasis, and what should I look out for with the elevated ferritin? Yeah, I mean, you can do different markers. I think CA99 can give you, pancreas, liver, even some colon cancer can be elevated with these markers. CEA, as I said, is a more general one. CA15-3 is breast cancer. AFP also can be used as a cancer marker. LDH can be used as a cancer marker. Alkaline phosphatase, which is a liver enzyme, but can be used for bone metastasis. But as I said, ferritin, it doesn't hurt to make full blood tests that add all the tumor markers just for peace of mind. But as I said, elevated ferritin might be just increase the inflammation. And you should take lactoferrin too. Maybe there's some iron binding issue, because lactoferrin can lower ferritin. Part 1 of my question is above. Thank you. I'm not sure where is it. I cannot follow it. Hi doctor, my mother's breast cancer got into momentum, but one PET scan was done in September, as you read. Now doctor again wants to do PET scan. No. I mean, these doctors are crazy. These PET scans and CT scans should be done each 6 months. In very severe cases, when there is maybe a justified reason, 4 months. But doing it each 2-3 months, or like in this case, I don't know, 1 or 2 months, it's crime. So no, big no. Should say no. Ask for MRI without contrast and high definition ultrasound. These are the 2 which are safe and can be done each 2-3 months. PET scans, CT scans, big no. It's gonna all this radiation poisoning is gonna fire up the cancer. It's gonna cause new cancers. So it's a big no. And of course it's very expensive. That's why they want to push it as much as they want. So big no. Yes, do blood test, and you can have ultrasound and MRI too. Is it possible to do your cancer protocol as a vegan? Vegans are very sensitive. So no. No, I mean, unfortunately, I'm having a lot, maybe they're watching, I have a lot of cancer patients who come to me. I have a case report, the last case report about a cancer patient who was in vegan diet. Anemia, inflammation, high blood glucose, low cholesterol, poor digestion. No, I don't think it's the best thing you can do. I would rather you do animal based rather than a vegan. So I have even the worst patients were definitely Indians, which are most of them vegetarians. And making them switch from that is a challenge. But I think I find out they always agree to eat sheep and goat and chicken and fish. They are okay with that one. So if beef is a big thing for you, you can skip it. But especially if you followed conventional treatment and you are anemic and then inflammation, you need to eat liver. You need to eat a lot of liver, beef liver, or as I said, if you cannot, just sheep liver to fix the anemia. So there's nothing better than liver to fix the anemia, to fix the lower red blood cells, of course combined with vitamin C. There's nothing better than animal fat to increase cholesterol, which is vital. So no, it's a personal choice. But for example, if you want to do work with me, you cannot be vegan. So unfortunately, that's the thing. Outside cancer, I respect all people. I respect all diets. It's your choice to choose what works for you. In cancer, no. In remission, how much milligrams of ivermectin, mebendazole should be taken? If you are in remission for a long period and you want to start ivermectin, mebendazole, as I said, you can have circulating tumor cells test and then see if maybe you need it or not. But you always start maybe lower dose, 12 milligrams of ivermectin, and then 150 or mebendazole or 100, and then maybe the upper limit would be 24 milligrams per day ivermectin, and then maybe 500 mebendazole or 250 mebendazole. But it depends. So it depends on if everything is clear, circulating tumor cells are 0, and you want to take it as a prevention, I would just you'll be okay with a lower dose. But if you see any suspicion of anything, then the dosage definitely has to be higher. But if you are in a mission, again and again, stick with the basics. Eat clean. Don't eat junk. Don't eat high sugar, processed food. Be careful of the toxins in your environment. Take vitamin D, omega-3, magnesium. Exercise. Go out. So these are the essentials. And then if you take on top of that ivermectin, mebendazole, just for preventing cancer from growing back, that's a good thing. Should one have to take fen and man, or is it enough with ivermectin? No, ivermectin is not enough, guys. When I talk about ivermectin in videos, people think I'm talking only taking ivermectin. Ivermectin is just 5% or 10% of the protocol. There's 20 other things you need to do. So it's not a standalone solution. So it's not a miracle pill that you take it and then you become cancer free. So you need either mebendazole, fenbendazole. You don't need both with ivermectin, and you need the whole protocol, head to toe, with the diet, fasting, natural supplementation. You need everything. But ivermectin alone is not enough. Are there any bladder cancer markers in the blood? For bladder cancer, I'll look for CEA and CA99. Usually, you can maybe AFP, maybe LDH. They will show you some elevation. It doesn't have to be tumor markers. It can be. For example, you test LDH and it's very high. It's off the chart. That means lactic acid is very high. That means active cancer. You can use that one as a benchmark to track. But to answer your question, I think CEA and CA99 can show you the bladder cancer. Sometimes it's not, so you have to rely on other cancers, I said. Can you talk about estrogen, breast cancer, fixing leaky gut and candida? Got my liver number to normal and CA15 in normal ranges. Want to come off of letrozole when it's safe to come off. Oh my god, this is a big topic. This is because if I talk with this, there will be other 100 questions popping up. So okay, fixing leaky gut. Okay, carnivore diet. You should, for leaky gut, should definitely stay away from most of vegetables, especially beans. And the best thing for any digestive problems, it's closer to carnivore diet. Definitely, I would use carnivore diet, and I would use zinc, carnosine, bone broth. These are the best thing you can do. And then if you have autoimmune disease because of the leaky gut, then I would use vitamin D, zinc, selenium, turkey tail mushroom, and if necessary, low dose naltrexone. What else? Yeah, I mean, hormonal therapy is useless, to be honest. Yeah, I will talk about it when I'm ready. So when I cover the topic fully, and then I can answer all the questions. But yes, I mean, just hormonal therapy. I have I think almost every metastatic breast cancer patients come to me. They used hormonal therapy. They crash their estrogen. They feel terrible, and they still get back to cancer. So most of the cases useless. Fenbendazole or mebendazole ovarian cancer. Both are good. There's no particular one for. Okay, I lost the question. Okay, yeah. So use what you can have. So if you can have mebendazole easily, get mebendazole. If you can have fenbendazole easily, get fenbendazole. Doesn't matter for ovarian cancer. So. Or if you want to start one and then try it for 3 to 4 months, and if you think it doesn't work, you can switch then. So, but there's no particular one for ovarian cancer. Audio could be a bit higher, okay? Audio is good. Yes, we can hear you. For breast cancer, fenbendazole with ivermectin or mebendazole with ivermectin. But same as ovarian cancer. I already answered it. That doesn't matter. So both, you can have both. You can have both, and you can start with one and change to the other later if you don't see results. You have metastatic breast cancer, hormone positive. I have metastatic in metastasis to the bones. How many days to use fenbendazole ivermectin per week? 5 days in, 2 days off, according to the protocol. You always take 2 days off, and on that 2 days off, you fast. You continue taking natural supplementation. You can do baking soda in the 2 days off, as in the protocol. But yes, most repurposed medication is 5 days in, 2 days off. Can metastasis on the bones disappear by using fenbendazole ivermectin? Yes, but I think I definitely yes, but chlorine dioxide solution is the one I like for bone metastasis. So use chlorine dioxide solution with DMSO, and hopefully the bone metastasis will be gone. Hey, I'm sick. Can we eat? Sure. Can we eat chapati most of the time for dinner? Is there alternative or stop altogether? Does age matter when we stop or not? I don't understand the answer. I don't understand the answer. What if alkaline phosphatase is 39? Could this indicate bone metastasis? No, 39 is low. Alkaline phosphate is low. Alkaline phosphate is not an issue. When it's elevated, then it's an issue. Sir, what does the protocol cost typically includes? The protocol is for free. This is what people, I'm surprised when people ask it. The protocol is for free. I don't sell anything. The protocol is for free. Of course, you have to buy the supplements. So you have to buy most of the supplements on the protocol by yourself. And then I think it depends on the quality. It can be from $500 to $1,500 if you want to buy the best, quality supplementation. If you do hyperbaric oxygen therapy, all the fancy stuff, I think maybe that's the upper end. But that's outside of me. The protocol is for free. All the information, the videos, different protocols, different cheat sheets are everything for free. You just have to take it, study, make your own research, ask around, maybe have a local doctor that's maybe affordable based on your country to monitor you. And this is how you do the protocol. But from my side, it's just you pay when you want my time. If you want a consultation with me, you just pay for my time. But the protocol is for free. My grandparents have a lot of inflammation and they can't walk because their knee hurts so bad and their blood goes high and low. Grandparents, the solution I'm gonna tell you, it's gonna be hard to apply it as they're old. They cannot change the diet. They can not change the eating habits, the lifestyle. So it will be challenging. But if a clean diet, definitely clean diet. If they have bone problems, definitely the diet, inflammation, something ketogenic diet or maybe carnivore diet. Take a lot of supplementation, vitamin D, curcumin, start moving a lot, fasting. So these can help a lot, but it depends on how are open to, if they want to follow it or not. I am convincing. Okay. What do you think about slow juicing celery juice in the morning? Isiac tea, artemisia? Oh my god, these are too many things, my man. Celery juice, I think is good. I don't think it's as bad as the other juices people use. I think celery juice can be good. Isiac tea, I think it's good. Artemisia annua, I think it's good. Vitamin B17, I think it's good. High dose vitamin C, I think is good too. How much vitamin C would you use? If you think about the IV, if you are talking about the IV is 25 grams on the lower end and 100 grams on the upper end, 3 to 5 times a week. That's how what I would use it. But it depends. Again, it depends on the stage. It depends on how aggressive you want to go. With 1,000 followers, just 26 in this live with good information. No, I mean, yeah. No, I have 150,000, followers in Instagram, but this is the first time I'm trying in YouTube because my old YouTube was banned. So, it's completely gone. And then I have a second channel and I was restricted for a while, and then they let me again put videos, and I'm just testing for the first time, and I will see. But I have a feeling they're gonna remove the video and ban me again. So, but we will see. But I'm not in YouTube. That's the thing. So if I post something, it gets removed, it get banned. This is why I don't use YouTube at all. So yeah, I mean 26 is very good. I'm very happy with it. Why would bicarbonate be high? If you think if you are talking about the blood test bicarbonate, maybe you're taking too much baking soda, maybe, or maybe there is some mineral imbalances. I'm not sure. I need more details. I don't know why. How to reduce the fatigue during treatments? It's a hard question. So I think when you start, I think it's going to be at its peak. I would say fatigue is because of the this is another thing. Your body is fighting cancer. This is the most fatiguing thing ever. So it's just you have to relax a bit. It's okay to lay down. It's okay to feel tired a bit because your body is fighting. So this is the thing, unless it's something super severe. But if you are tired a bit, that's okay. I mean, there are some people like, I need to work. You're fighting cancer. You need to relax a bit. You need to take a break, take a vacation, relax a bit. But I think things to reduce the fatigue, I would say exercise definitely will reduce the fatigue. Once you get your diet right, if you are, for example, doing keto and then you are in high ketosis, then I think you start feeling way much better. The transitionary period at first is going to be the worst, and then things will usually go better. Yeah, I think for maybe supplementation, maybe radiola rosea you can take. Maybe it can help a bit with the fatigue. But usually, as I said, my patients usually get better after, maybe a while. They always struggle at the beginning, but after a while, you should get better. If iron saturation is always too high, slightly higher than normal range without eating or consuming iron during 8 months. What could be the reason? Maybe iron binding issues. So I think you should definitely take lactoferrin and vitamin C. Maybe you have an iron binding. I'm not sure about is the iron in the right level. Then, as I said, maybe you should take lactoferrin and vitamin C, and then should be okay. Because iron is so you basically your body produces its own iron, so it breaks down the cells and then makes its own iron. So, but usually, I'm not sure if you are a man or woman, but if you lose a lot of iron, then you have to replace it somehow. But I don't think it's a concern. First, second, you can take lactoferrin or vitamin C. Doctors have declined chemo and radiation for stage 4 prostate cancer, ALP and PSA raising since July. No castration resistant. Scans since August haven't shown much progression in the bones. Doing MAKES protocol. Okay, so is this a question? Doctors have declined. Stage 4, ALP. So it's a prostate cancer, metastasis to the liver, to the bone, sorry, and then there's no progression, but the markers are raising. In the scans, there's no progression. In the bones, okay. And then you're doing Mike. Look at the first case reports on my profile. There's exactly stage 4 prostate cancer metastasis to the bones, and they use chlorine dioxide solution with ketogenic diet. So we should definitely check that, and then maybe you think about including these. In my experience, actually, prostate cancer is one of the most tricky cancer. It's very tricky. It's very resistant. I mean, this is why there's this famous guy. I think I don't remember his name. He's in Twitter or X now. I think he's very famous streamer or something like that, and he has prostate cancer because of the COVID, and he tried a protocol and then he failed, and he's very bitter and then talking super bad. And then I know about that because I had some prostate patients, and it's very, very tricky and very resistant, and you have to try multiple things. And I think I remember, like, I think we, there's a versions of the protocol because we need to adjust with the patients, and then at version 7 or 8. So the iterations it took to basically bring down the PSA and then, make, positive progression finally. Yeah, because it will, you should definitely look for blood glucose levels, hemoglobin A1C, and AGF1. So these are the main things. Look also for inflammation because these are usually the drivers for prostate. And yes, so you need to be very, very active and adaptive with prostate cancer in order to make a progress. No, I mean the consultation. I don't know what does mean. I live in Turkey and I have bladder cancer, delegate, and my doctor wants me to do cystectomy where they take your bladder. He also recommend me to take and for them. As I always say, I had 2 patients today. 2 of them, they want to rush them into the surgery, and they always say, don't let them rush you into surgery. Surgery should be always the last resort. Okay, they have a reason why they want to rush you. It's part of their protocol. It's about their system. It's a quick cash out for them. You should try everything before do a surgery. So you're not gonna die. So you should take a break. Not take a break. So take a step back. Think what you can do alternatively to reduce the cancer. Try to heal your bladder. Give it 3 to 6 months. Give it 6 months. If it doesn't work, then of course you go for them for the surgery. But don't let them rush you into surgery. Don't make surgery your first resort. Because guess what? The surgery don't kill the entire cancer, so it will come back and it will metastasis. So you almost guarantee metastasis if you do surgery. So you are now within the same cancer and with new metastasis and without your bladder, with a poor digestion, and then healing becomes even way, way more difficult. So delay the surgery and try everything else. There's a lot of protocols. Try your best to not do surgery, to avoid surgery. And after 6 months or whatever the period, right? So give yourself a period. Then you can always come back to them so they can torture you or whatever they want to suggest. So always protect your organs. I want to say it. I want to clip one. I will clip this one. Don't let them rush you into surgery. Always try everything to preserve your organs. Always protect your organs. Surgery should be the last resort. if you do surgery, you will still have the cancer come back, and it will metastasis, and then you will be stage 4 without, your initial organ, the prostate, the ovaries, the breast, all of these. Like it's in maybe the bladder is, it's not. Of course, it will significantly affect, the digestion, but they cut out the woman breast, and they take out their ovaries when they are young, and they take out the men prostates, and these people, are traumatized for life now. So and then how are you gonna heal, and how are you gonna be positive when you're like you don't have your full organs? So it's a bad thing. It's a very, very bad thing. So never rush for a surgery unless it's a life or death situation. If you tell me, it's severe pain, the cancer is, very progressive, we need to do it as soon as possible, then maybe. Or another thing, if it's surgery with isolation, they can isolate the tumor without affecting the organ, then that would be okay too. But removing organs, no. Adjuvant therapy, I'm a bit lost on this matter, although I am doing water fasting. Adjuvant therapy. What do you mean by adjuvant therapy? What would you recommend? What would your recommendation to start with? I mean, check the protocol. You should check the protocol and definitely read the protocol, and start researching and start applying the protocol. That's the thing. What do you think of alkaline juice in such cucumber, lemon, bicarbonate, sodium? If we have a consultation with you on top, we will have to buy supplements. Is that correct? Does oxygen therapy help? Okay, these are a lot of questions. I mean, of course you have to buy. I mean, you have to buy the supplements on the protocol regardless, because I don't sell supplements. I don't sell anything. So you just one of my time, my experience, then you book a consultation. You can personalize the protocol based on you and your condition, and then your metabolism. But of course, you have to buy the supplements. Is outside me. Oxygen therapy, yes, hyperbaric oxygen therapy is great. It's a great addition to the protocol. Juicing with cucumber, I think bicarbonate, sodium, and lemon is great. I added it recently to the protocol in the 2 days off from medication. You have to take it 3 to 5 times. I think it's amazing. Amazing results. Juicing, not sure. Because again, so look guys, so this alkaline diet, alkalinization, if you do it too much, if you take a lot of alkaline in, you neutralize your stomach acid, and then you cannot digest the supplements, and you cannot digest the food to extract the vitamins, minerals, and to actually let these supplements work. So the worst thing you can do is overdoing this and over alkalining your blood and your body. So it should be done strategically. So for me, that's why I put it in the 5 days in. So 2 days off from the repurposed medication and everything, and then you have to do it a bit intensively, and you have to do it separate with 2 hours while fasting. So this is the best, I think, combined effects. But yes, so don't overdo it. How many milligrams of ivermectin should that be used for hormone positive? I think it's written on the protocol, so it depends. It depends on stage, depends how aggressive it is. I think there's a range that So for stage 1, maybe not very aggressive, progressive. That's on the left side. Stage 4, progressive. That's the right, the right of the range. So the right side of the range. So it can go up to 1 milligram per kilogram, and then it can up, in some cases, it can even go higher. What should be avoided in food wise, please? Vitamin C, beta glucans, vitamin D. What should we be avoiding food wise? I mean, for active cancer patients, definitely starchy food, high carb, carbohydrate food, processed food, junk food, anything with added sugar, starches, as I said, I already mentioned. Vitamin C is good. Beta glucans is a must. Vitamin D is a must. Sorry you didn't understand my question. I meant we eat a lot of white flour, mostly for dinner. No? Is there alternative for flour or stop altogether? Are you talking about like a healthy person or a cancer person? So white flour is always bad. So I don't recommend it for even healthy people or cancer people. Cancer definitely patients definitely they should not approach white flour. For healthy people, no. You can have sourdough bread. I can, for me, I'm a healthy person. I eat sourdough bread sometimes. I think it's good. There's some gluten-free, clean alternative. Not everything is good, but white flour, no. Please continue if you can. Continue what? Hi, my father was diagnosed with pancreatic cancer 6 months ago. We did 10 by 14 centimeters on the pancreas. Okay, what's the question? Let me read another. Also high vitamin D and zinc, etc. His tumor disappeared now. Okay. Please give advice. He has 2 spots on his liver, but not cancerous. Now there is a 3rd spot, and the surgeon says that's probably cancer. Yes, it's probably cancer. If you have cancer already and you have any, they say it's not malignant. It's high likely it's malignant. I'm not sure how the cancer disappeared. Are you following the protocol? That would be amazing. Thing you said vitamin D, zinc. I think you should continue what you are doing. I'm not sure what you have done. So, but if you are not, I'm not sure if you have not done the protocol yet. You should be on the protocol definitely to avoid relapse and also to clear these 2 liver metastases. But congratulations for the pancreatic cancer. Well, you need to be in a protocol definitely to avoid relapse. See the videos for members of your YouTube channel. Usually I won't get removed. I don't understand what you said. He also has been on very healthy diet. Okay, great. I mean, write a comment in multiple lines. So I it's hard for me to, because they will be mixed with other people. Thanks so much. Are you one of the last real doctors out there who really want to help? If we order from your repurposed drugs page, will be shipped. Guys, don't get me in troubles. I don't sell any medication or supplements. I don't sell anything, guys. Don't get me in trouble. So yes, there's a supplier which is I share this on Telegram link, but unfortunately you cannot get it in Germany because it's going to be stopped with the customs. But in Germany, I think there is a clinic there. You should look for this clinic. There's a doctor who, I think he do B17 IV, I think. I hope I'm not wrong. Should Google it. You should definitely find this man who has a clinic, and he can prescribe ivermectin and I think fenbendazole, mebendazole to patients. So I think I had a patient who talked with him, and he know me, but we never contacted. I don't remember his name. I don't remember details. But I just had one patient from Germany, and they went to this clinic, and they will be able to get this prescription. So please Google, alternative health, B17 IV clinic, doctor stuff. Maybe you can find him, and then you have to call and then ask for. But in Europe is a nightmare. It's very, very hard. US now is the best place to, because I guess at least you can test, the supplementation you can get from compounding pharmacies. There's a lot of third-party lab tests in the US. So US is the best place to be a patient in. Europe is Canada is the worst, definitely. Europe is most of the places are not the best. So yeah. Also, he has no cancer markers, and he was stage 4. Yeah, okay, it's always here. How often should I do oxygen therapy and the lymphatic body suit? Okay, I lost your comment. How often should you do oxygen therapy and the lymphatic body suit to help you? Oxygen therapy is 3 to 5 times a week. It depends which protocol are you using. If you use my protocol, then you can use it three times in the 2 days off from the medication, and on the 1 day on the purpose medication, but you have to stop chlorine dioxide when using hyperbaric oxygen therapy. You cannot use both. So if you're on another protocol, then 3 to 5 times. In my protocol, then 2 to 3 times a week on the 2 days off from medication. How often should you? Okay, please advise. I have also been talking to you on Instagram. I don't remember you. Sorry. I'm very, very sorry. I hope I answered about what you need to do. You are the best doctor. Thank you so much. I really appreciate that. He also has lymphatic drainage massage every week. He also doing fascia. Best parasite protocol for women trying to conceive. Oh my God. Pregnant women is very, very sensitive topic for me. Unfortunately, I don't have so are you having a problem with conceiving and you thinking it's linked to the parasites? If this, then yeah, you can do ivermectin and fenbendazole or mebendazole. I think 12 milligrams ivermectin, 100 or maybe 200 of fenbendazole, maybe 3 to 5 days in, and then you take days off. Combine it with maybe Zyolite as a binder. You should take also, vitamin D. You should take vitamin D, omega-3, magnesium. These are must. You should work out and you should look at for your hormones. Maybe there is inflammation, there's hormone imbalances, and then I think if you fix your hormones and then you fix inflammation, you fix your metabolism, and then hopefully you can conceive. And I wish you the best. Parasite protocol, wormwood. Yes, that's a good natural parasite cleansing. The wormwood, the clove, and black walnut whole. So if you can have ivermectin, fenbendazole, mebendazole, I would use these ones too. Yeah, the Hulda Clark protocol. Yeah, I think that's good too. I would use that if I don't have the ivermectin, fenbendazole. What do you think of intra vitamin C? I don't know about that. I know the IV vitamin C. He said it's good. Exercise definitely helps. And how often should we fast per week? Intermittent fasting every single day and 2 days fasting each week. What about galvanotherapy? I saw great cases, especially for prostate. Which galvanotherapy? I don't know about that. I heard about this somewhere. Let me know what's galvano exactly, because I don't recall. But thanks for explanation. Thank you so much. You're welcome. If wormwood, clove, black walnut, too toxic, affect infertility? I don't think so. I don't deal with these, but I don't think so that they are toxic. I think one time I heard about a woman who were struggling to conceive, and she took black maca, I think. And then I think she's changed her diet. Should also maybe change over her diet, try different diets, try keto, try carnivore, take maca. It could be balance your hormones, take sulforaphane, maybe estrogen problems, maybe cholesterol problems. There must be some metabolic dysfunction then making it hard. But I don't think this will affect the fertility, but double check. I don't deal with these. This is why I cannot give my opinion. Please can you share a link where to get real supplements? As you stated, some are fake. You mean the natural supplements, or you mean the repurposed medication? The natural supplements, usually I have a list of the best supplements in the US, and then I share it with my patients, so they don't have to guess which one to buy. They just buy the right things immediately. I think I shared the link maybe in my exclusive platform. But the repurposed medication, you should. I think the wellness company is a good option now for a lot of people. I think it's a bit expensive, yes, but I think it's worth it. I think it's worth the at least the quality is insured from compounding pharmacy in the US. Yes, it's very expensive, but it's at least the quality is insured. For the other places, outside the US, it can be challenging a bit. What's the name of the clinic? I don't know. I don't know. I told you I don't recall anything. I know it's in Germany. I know they do B17 IV. That's what I recall. So unfortunately, I don't recall anything. Is apricot kernels good to take? I think it's good. I don't have strong data on it, but I think it's good. So I included there's a period where I included apricot kernels in the protocol. I didn't see much change, so I think it's good to take 3 to 7 pieces 2 times a day. But as maybe standalone or I don't see I wish I would see case reports before and after using apricot kernel seeds, and then they have amazing results. I still didn't see that. Any alternatives for refined white sugar? Allulose and monk fruit. These are the best. Dr. Rat in Germany has some supplements. I'm not sure. Ivermectin. Dr. Rat. I'm not sure if it's Dr. Rat. I don't remember. If maybe someone, if someone say a name, I recall. Sorry. Yes, problems with conceiving. Yeah, man. As you said, I will do extensive blood test, check everything. I'm my first suspicion would be hormonal imbalances. So I'll check testosterone level, estrogen, progesterone, DHEA, prolactin. Sorry. And then I would look after these markers. I would see inflammation markers. I would see the blood glucose. I would see the cholesterol, as you said, thyroid. I would look at everything and try to see what's out of range, what needs to be fixed. And then I'm not sure if you are, because your name is Johnny, maybe it's like your wife. Yeah, like exercise, eat super healthy, fix sleep, take vitamin D, as I said, omega-3, magnesium, these are must. Try different supplementation. It depends on, what's the goal. But if it was, my wife or I would do the same. So, hey, doctor, wanted to thank you for all your help. Your protocol is really good if we follow it. Yeah, thank you so much. Thank you. Appreciate that. How many times a week to take CDS? 5 times. 5 days on, 2 days off. Purpose supplements to heal. I don't know what's the question. How long? Okay, the question stopped. Okay, it's still working. I thought it's some off or something. How long need to take ivermectin? Do you have a recommendation for who is using it? I have for my husband for 6 months, but the doctor said he needs to check liver every month. Yeah, he's right. He's right. Whenever protocol you use, if you use ivermectin, if you use any other protocol, you need to check liver markers each 4 weeks, not because these are toxic, because they just sometimes they just overwhelm the liver and it works too much and it releases a lot of enzymes. And then of course you need to take a step back, take a break for maybe some days and then test again. And then if they come back, then you can carry on with the protocol. To recommend chlorine dioxide solution with DMSO for metastatic breast cancer with lymph node? Yes. How soon have you seen improvement restrictive following the protocol? It doesn't matter. I always say 6 months. That's where you make a judgment about the protocol. But there's cases for 6 months, there are cases 2 years. So it doesn't matter. So I know, this is the issue with cancer patients. They want to have it now. They want, fast results. It takes time, It took you 10, 15 years to get cancer. So, it's not bad to take 2 years to heal. So that's the thing. So, of course, you don't want to see your health decline severely and then huge cancer progression, but usually it doesn't happen. But yes, I think 6 months you can make judgment or like prejudgment, but yeah, 2 years, I think it's maybe the upper limit was of what I saw. My liver enzymes are a little elevated. Never happened before. Only after I use supplements for parasite glands. In general, I'm healthy. A1C low, 4.9. Liver enzymes, ALT 88, AST 48. What to do? I mean, these are mild elevation. You just stop the supplements and it will come back. So, and again, take Mectisol, Tutka, and then the line root T. So, and usually it's, this small elevation doesn't worry me. I'm talking about elevations like in the hundreds. So in the 3 digits, that's where it's like, you have to be careful a bit. But the double digits, it's usually it's not a big concern. Is the clinic in Hanover and is Dr. Wolf? I'm very sorry. I cannot recall. It's just it's a one email and a conversation happened and they never concentrated with. I had prostate removed in April. Oh my god. Oh yeah. I have had a few PSA tests. PSO is 0.5 on all the tests. Doctor said this is 0. Is that true? Yes. I mean, if it's I think less one, that means it's usually it's okay. It should be very very low. But again, if you remove the prostate, you don't get rid of the cancer. There's a very high chance you will come back in metastasis. So you need to follow the protocol. You need to kill cancer stem cells and prevent metastasis. So you have done nothing. You just now remove. Now you're without prostate, and you're just with a temporary win. But there's a very, very high chance it will come back in metastasis. So you should follow the protocol as soon as possible. Yes, Dr. Putish. I think this one. Yes, it's him. Dr. Putish has a clinic in Germany with vitamin B. Maybe it's him. I will ask him. He can prescribe me ivermectin. Yes, this is him. This is Dr. Putish. You see, if you, it was in my mind. It's just hard to. It's hard to remember. What do you think of Solgar supplements? I saw this brand. I'm not sure. Dr. Muhammad Ali Zayan is the one in Germany? No, it's not. It's Dr. Potish. Forgot to mention in the past, CT scan showed fatty liver, but didn't know what to do. But the fatty liver, what is your triglyceride level? So, again, if I start asking you, I will maybe start to figure out what's the issue. This is the pregnancy woman, right? No, this is not. Yeah, it's her. Yeah, it's his. Yeah, it's the same name. Yeah, that means a fatty liver. That means insulin resistance. That means cholesterol levels is off. So you need to fix all of this. Maybe I'm not sure what fatty liver is. It is she overweight? Then yes. So once you start asking questions, doing a lot of blood tests and scans, you will know what to do. So you should fix every single metabolic dysfunction, and after that, hopefully, she will be able to conceive. Forget to mention Dr. Anane Hyper Center. No, it's not him. It's Dr. Putish. I've heard when we take ivermectin, we need to take milk-thistle. Is it true? Sorry. Yes, milk-thistle and TUDCA are very essential in the protocol. And you don't take ivermectin alone. I'm not sure if it's parasite, yes. But if you have cancer, you need to follow the whole protocol. And it includes milk-thistle and TUDCA. These are essential, both. Thank you for all what you do. You're welcome, Terry. Appreciate that. Okay, guys, I think the comments stop coming. I'm not sure how many viewers I'm having now because I just zoomed out on just the comments. Okay, how many viewers? Okay, 25. Not bad, not bad. Okay, maybe we will do another 13 minutes and then I will be gone. Okay, so you have questions? Yeah, Bruce put it. I admire your info. Blessing my dad's enlarged prostate for 5 years now. He takes meds. He really doesn't take it seriously to change diet strictly. PSA levels are low. How to get rid of it of me. Hopefully you're saying it. Enlarged prostate is saw palmetto. I will use apigenin. I will use DIM, and I would use stinking natural root. And then of course you need to fix the diet. And also use curcumin too. And he needs to fix the diet. And usually older people are very, very hard to, convince. But yes, for the prostate health, I would use these one. Is there a difference between fasting 2 days a week, 48 hours, and fasting 72 hours? Would you approve if 72 hours fasting while your protocol or strict? 72 hours, I mean, there's nothing wrong with 72 hours, but it doesn't fit with the protocol because you want to take the repurposed medication 5 days in and then 2 days off. If you take the repurposed medication when you are fasting, it can have some digestive issues and then also some increased maybe symptoms. This is why I like to take it only when with food. So just for prioritizing and structure reasons, but maybe if you are following another protocol, you can do 72 hours, no problem. Sorry, doctor, it's me joining again. 165 centimeters high, weight 70 kilograms, ratio HDL, triglycerides under 1.5. That's okay. Okay. Wait. Sorry. So, okay. So, Johnny, you're talking about conceiving as a man or a woman? So, because all what I said, I thought it's like because I thought you were talking about your woman conceiving, but are you talking about yourself or your woman? So please, clarify. So because I think that maybe my answer would be different. So no cancer. I have just learned so much from you. Thank you so much. Thank you very much. I really appreciate that. are there any supplements that need to be stopped during the chemo days? Most of the supplements you need to fast during chemo. Complete fasting. I think 12 hours before, 12 hours after, minimum 24 hours before and after. That's the optimal. Yes, no supplements at all. Just fast, and that's it. And then you can continue the protocol outside that. But I'm not endorsing. I'm just answering your question. In February, they removed my uterus. Again, surgery. Tumor was too big and I already had problems. Okay. How long following your protocols there were cells left? Did not do chemo radiation, but vitamin C, curcumin. So you had the surgery back in February. Of course, there will be cancer cells left, and it's a matter of time they will come back and metastasis. So you should follow the protocol, the whole protocol head to toe. And then you should test for different cancer markers, CA 125, 99, CEA, inflammation markers, everything. You do circulating tumor cells too, to see how much, tumor cells on your blood. And then based on that, of course, it will determine how long you should follow the protocol. You have to measure. There's no guessing. I don't like guessing. Measure everything. Blood tests, scans give you the answers. Of course, I'm saying the MRI and ultrasound or thermography, these are the safest scans. And also blood tests are usually safe. So when you do anything, you have to do tests, you have a benchmark, and then you do the protocol, and you do tests each 4 weeks to see the progress, to make sure the kidney, liver are good, and this is how you measure the progress. Hey, hey, we spoke about my mom's rectal cancer on Instagram. We opted out of the surgery because the CT scans is clear, but biopsy is 10% cancer. What should we do? We are following just follow the protocol. And then again, do full blood test, see what metabolic dysfunction is there. Is there inflammation? Is there anything that needs to be corrected? Make sure to correct everything. And then maybe repeat another MRI or ultrasound. Make sure, maybe this tumor or cyst, it will be gone too. So this is how you do it. 3, that's right, 66. Always say I have high cholesterol. No, that was asking for my sisters. Man, I'm not sure you are asking about, because you say my cholesterol. Are you asking your cholesterol or her cholesterol? Who? You should specify, because I'm lost with your questions. Is Dr. Seyfried your mentor? Because he said all cancer are likely the same. So is it possible for tumors to completely disappear with protocol, keto diet, and repurpose? Yes. He's not directly my mentor. I appreciate Dr. Thomas Seyfried. I think he's one of the few really people that understand what he's doing. So when him and Dr. Paul Merrick, I think these are maybe the only two when they just, they speak wisdom. When they speak, it's just you take your pen out and then you start taking notes. These are people that really, really understand cancer, and then they dealt with cancer patients, and these people are amazing. These are the only one I really take seriously and listen. But unfortunately, this is our topic, but there's a lot of people with big following, and they talk about cancer, and when they talk in a very convincing way. But when I listen as an expert, it's like they have no clue, because they think cancer is other diseases. Because they don't talk about health in general and other diseases, they think cancer is other diseases, and they try to give their 2 cents information. And it's just because, of course, they have a high reputation, they have high authority. People, maybe they listen to them, but they have no clue about cancer. But unfortunately, the two big ones, like really big ones, like Dr. Thomas Seyfried and Paul Merrick, maybe there are maybe one or two others, I'm not really recall, but these are, the big guys. These are should have millions of followers, but unfortunately no. So that's that's the issue. But yes, that's why guys, when you send me videos, oh, what do you think about this? This say this is like I just laugh. I just feel sorry for you if you felt for all of these suggestions. I just I don't want to talk about anyone. So, I just you have to understand something. I made a promise when I started. I will never talk about anyone in a negative way. I will never react to any videos. I will never react to any person, or as he said, or any particular issue, or like targeting some person. I just want to focus on my work, cancer, the best solutions, and that's it. So even if someone, maybe someone, if you mention me, then I can be a bit more ruthless with that one. But yeah, I don't want to react to anybody. I just want to focus on my work, cure as much people as possible, have the largest case reports ever, and that's how I just want you to be careful with whom you take the information. And ask the question, do you have a case report of this one? Do you have some data? And if they don't, then just ignore them. That's no matter how big they are and famous they are. Okay, so I ranted a lot about this topic. Coming back to your cancer, yes, all cancers are the same. As I said, what different is the organ. The organ will have special maybe treatments, like additional supplements, or maybe like a different care based on the organ, but cancer is the same. The metabolic pathways almost, they share a lot of similarities. There are few differences, but doesn't make it super different from so cancer is cancer. So that's the thing. All these mutations, different names, it's just a noise, because they want to justify different treatments, different chemos, because if they say they want one case, one cancer type, they would have one chemo. So they have to create all of these cancer types, and then just to justify different treatments. Okay, so that's the thing. Can one combine your protocol with immunotherapy? Technically yes. So that's your answer. So technically yes. I admire your knowledge, and I like learning all these for myself. I don't agree with the vaccines, all the big F protocols. Thanks again. Thank you. I really appreciate that. Cholesterol for me, can save it for my sister. Sorry. Okay. Cholesterol for you, can save it for your sister. Yeah, cholesterol for you, just eat healthy fat. So avoid seed oils, avoid sugar, avoid processed food, exercise, eat healthy fats. Eggs, salmon, avocados, olive oil, MCT oil, butter. These are the healthy fats. Will decrease the bad cholesterol. Bad is not such. There's no such thing as bad cholesterol, but reduce and decrease the HDL, which is essential for the hormones. For your sister, I already answered. What she needs to do mostly. Thank you, Doc. The last MRI was completely clear. Congratulations, that's great. But can't say she's no evidence of disease because of the stupid biopsy with surface cancer. They couldn't even do one test because the lack of cancer on biopsy. If MRI is clear, as I said, do full blood test, do circulating tumor cells, follow the protocol, continue following the protocol, and then after 3 months do another scan. So MRI is now contrast. It should be safe. So you can do it each 3 months, 6 months, but make sure to do consistent blood work and fix the metabolic dysfunction. If there is anemia, if there is suppressed immune system, if there is inflammation, if there is high blood glucose, these are needs to be fixed, or the cancer will come back, or for sure. So that's it. Less than 10% cancer cells are less than 10% cancer cells out of 4 biopsies. I don't know. I don't understand what does it mean. My husband has a doctor in Brazil that orders many lab tests, but the oncologist in the US says she can transcribe the order because he don't need to see these markers. These doctors are stupid, just, go to a private lab, transcribe. I mean, he cannot translate it, you mean? Transcribe it, translate it. Learn how to read the lab tests by yourself. Learn what each lab means and do it, rely on yourself. Don't rely on these doctors. You go to your doctors, you just maybe do scans. Maybe if anything urgent, you have been admitted to the hospital, then you talk to the doctors. Outside that, just, you have to rely on yourself. You have to take your health in your hands. Don't rely on these stupid people. It's true, triglyceride, HDL, healthy cholesterol, what numbers are okay. I think you just have to look for HDL. So low triglyceride and then high HDL. So if you fix these two, and per the lab test, I think you shouldn't worry about the ratios and all the cholesterol markers. Thanks for explanation, but was the yes yes, a tumor can disappear with yes, can be, of course, it can be. It should be. Vitamin D3 with K2 and omega-3 supplements. Should I pair these with other supplements? Vitamin D3, K2, omega-3 supplements. Should I pair these with other supplements? Which other supplements? Is meat in keto diet also good for liver cancer or gastric cancer that has spread to the liver and bones and all the supplements in your protocol safe for this one? Man, you are putting me in a corner. I mean, generally safe, of course. I'm talking about you have to monitor everything. I think steak is amazing. I posted a story. There's this guy who tests basically his blood glucose levels with each meal, and then he show you the blood test. He has continuous glucose monitor in his arms, and he tests the blood glucose. And he took like a nice, very nice juicy steak with avocados, and he ate it, and he saw steady blood glucose. There's zero innovation. That's the best thing that can happen to cancer patients. If you just eat that one, you can get rid of your cancer. But people are just so simple things, but for some reason it's hard for a lot of people. So yeah, go look at the last story. I just shared the videos. That's amazing. That's the best thing you can do for a cancer patient. What supplements to use for kids? Oh, you're asking too many questions, man. you want to ask for the whole family. I don't deal with kids, so I don't know how to to dose for different for small kids. Okay, guys, I think I'm gonna have to go. If you have some questions, just pop it up quickly. What do you think about mistletoe injections, ozone therapy, PMF? These are good. These are additives, so I'll add it on top of targeted metabolic therapy after I target the cancer effectively. And then I have to add these strategically because, as I said, like if you want to add these in the protocol, you have to do it in the 2 days off only because you cannot fit it on every day. But it depends on the protocol you are following. But these are not standalone. These are alone. I see a lot of people go to fancy clinics, get only these, and then, they have no effects on the cancer. The opposite is like the cancer grows. These are additives, good. They can, boost the protocol, but they are not essentials. But these are all good. These are great. Did a test that said my natural killer cells will improve by consuming colostrum, yes. But as I know, it also increases insulin-like growth factors. What would be bad if there are cancer cells? I don't think colostrum would increase IGF-1. For natural killer cells, to increase it, you have to take vitamin D, zinc, selenium, turkey tail mushroom with high beta glucans. And if they are super low to go up, you can boost it with the natural killers, not natural killers, low dose naproxen. So you can add low dose naproxen after you try vitamin D, zinc, selenium, and turkey tail mushroom. If you didn't get the boost you wanted, you can get add low dose naproxen. Cholesterol is good too. It's good for blood counts in general. So I'll take these with vitamin C. Mistletoe injection on 2 days off. Yeah, can be done. Can you please explain why fast during chemo? Yes, that's exactly. I mean, it's just. I mean, I'm not telling you to do chemo. I don't endorse it, but I answered your questions. But fasting is the best. I mean, it's clinically proven that it lowers the symptoms and prevent a lot of damage. But you should do the protocol outside that one to mitigate the damage too. Thanks. Happy weekend. Thank you much for you too. You suggest liver. Yes, liver is the best thing to anemia. Number one. Oh my God, the high glutamine. Okay. I mean, this is why I mentioned, I don't want to mention names, so, I will ignore. So I heard low glutamine diet and whenever say someone is like low glutamine diet and you should eliminate glutamine from your diet, this is how I spot someone who doesn't understand cancer. So you should lower glutamine because they see research on glutamine or the cancer feeds glutamine, and the research of Dr. Thomas Seyfried. There is even this research of even before Dr. Thomas Seyfried, but Dr. Thomas Seyfried was the one who voiced it, and they see that as okay, we need to lower glutamine, low glutamine diet. I don't know how they came out with the low glutamine diet. So this is what I'm not sure. This is on top of their head basically. So glutamine is essential for the body. It's not like glucose. Glucose is non-essential. You don't need it. You can live in ketosis and you don't need glucose, or at least external glucose. Glutamine, you need it. Is essential for immune system, for your gut, for the metabolism in general, and your body produces glutamine. 40-60 grams of glutamine per day. So if you take in big steak, it has 2-3 grams of glutamine. Your body produces 40-60 grams. That's nothing. So whenever you hear, this is why I want you to learn, guys, and then when you so you can spot the bullshitters basically. When I said low glutamine diet and they come up with these names, immediately this guy does not know anything about metabolism and cancer and should be ignored. Okay, so I should never see you talking about glutamine or lowering glutamine, low glutamine diet. What we do is we target glutamine pathways, the mechanisms, how the cancer use glutamine, not glutamine itself, the mechanisms how cancer uses glutamine, and you target it with different repurposed medication. Fenbendazole can target this. I think the camera turned off. I think I'll continue only with the videos for a while. It's the worst. It turned off in the worst time. So we target the cancer using the glutamine. We target basically the mechanisms and the enzymes that use the glutamine with the repurposed medication and the supplements. And this is how you target glutaminolysis. It's not by the diet. It's not about lowering the meat or all that stuff. So, okay, never talk about low glutamine again. What's the best? Really, stem cells. Yeah, I need to go, guys. I think the camera turns off. I think it has battery 1.5 an hour, I think. Okay, so thank you so much. Definitely the next week I will be doing it. I think I enjoy it. I like it so much. I think it's good. I thought at the beginning no one will show up, but I really appreciate that you come. I'll try to make this weekly. I will see if the YouTube will ban me and remove this one or not. That's what we determine if we can continue or not. But I really enjoyed this one. And I hope to talk to you next week, guys. So cheers. Bye bye.